John Hunter has a very broad catchment area. We understand that patients and their families have to travel really long distances in order to be able to see us. In many cases, we can gather a lot of the information in advance, and with the collaboration of specially trained general practitioners, engage you closer to home so that we can get the information that we need and recommend treatments through that collaboration and communication, and hopefully save you long distance travel and hopefully a lot of time saved as a consequence of that.
In the clinic, I'll do an initial assessment of the patient. We only see children in this clinic, and see if there's anything else that needs to be done, like an additional hearing test, try some treatment first. And then we'll organise a video conference with the surgeon down in Newcastle.
So this is what a telehealth encounter often looks like. I sit here in the office at John Hunter, and we're able to see our colleagues over in Armidale and communicate directly by the webcam that we've got here. Also, often we'll have a look in you or your child's ears with a video otoscope. That video will allow us to be able to play that up on the screen here, and I'm able to look in real time or on a recorded image into the ear and be able to see exactly what they're seeing also. Often sometimes have a look inside the mouth and the nose just to get additional information. All of that we're able to then put together to be able to understand what is the problem, what treatment are we going to recommend, and then be able to talk to you through this screen in real time, explaining all of those things and hopefully being able to answer all of your questions.
So far it's been going really well. We've seen patients from as far away as Moree, Narrabri, Gunnedah, Tamworth, Warialda, so all sorts of places west of here. They still have a little bit of travel time to get here, but not as near as far as having to go to Newcastle. And they also get seen a little bit quicker here in this clinic.
Daniel suffers from epilepsy, and one of his triggers are ear infections. So we've actually had 5 sets of grommets over his lifespan so far. So there's been lots of travelling, and this one was the easiest on the family, the budget. We had a referral to John Hunter ENT clinic down there, and it had sat in the system for over 18 months and still couldn't get an appointment. And then one day we got the phone call to say they're starting up a clinic in Armidale and that we'd be the first patients up there. So it was only an hour's drive compared to 3.5. So we were able to go up there and get an appointment within the 2 weeks of hearing about it.
We're really quite proud of the partnerships and the relationships we have with the general practitioners in Armidale, and we really appreciate their work in assisting us in this.
One of our aims of the program is to be able to also educate GPs in the region about the types of patients that we see and give them some advice and some tips on how to manage the patients within the region, with the hope that they may not actually need to see an ENT surgeon. It is patient-centred in that we can help to manage people closer to their homes.
Travelling an hour compared to 3 and juggling family life around that as well. You know, it's not even classified as a day trip to go to Armidale, so it was excellent. Even though you're seeing a doctor up there, the telehealth was quite reassuring that images and Daniel's history were all sent through to the ear, nose and throat specialist who was on the screen talking to you. So yeah, you felt like you were still being seen by that professional.
The main focus of this program is all about the patients, and it's strength-based. It's very much person-centred. It's about making sure that the needs of the children specifically are met, and then of course their families as a repercussion of that.